Hi everyone, hope you all are well. Today I will be talking about CMS final rule for fiscal year 2024 hospice payment rate update. Let's jump right in. On July 28th of 2023, the Centers for Medicare and Medicaid Services or CMS issued a final rule that updates Medicare hospice payments and the aggregate cap amount for fiscal year 2024 in accordance with existing statutory and regulatory requirements. CMS is publishing this final rule in accordance with the legal requirements to update Medicare payment policies for hospices on an annual basis. Medicare hospice payment policies. This final rule discusses the comments received regarding information related to the provision of higher levels of hospice care, spending patterns for non-hospice services provided during the election of the hospice benefit, ownership transparency, equipping patients and caregivers with information to inform hospice selection, and ways to examine health equity under the hospice benefit. Additionally, CMS is finalizing regulations text changes related to the provision of telehealth services for routine home care with the expiration of the COVID-19 public health emergency and for the use of telecommunications technology for the face-to-face encounter conducted by a hospice physician or hospice nurse practitioner for the sole purpose of hospice recertification through December 31st, 2024. Fiscal year 2024 routine annual rate setting changes. The fiscal year 2024 hospice payment update percentage is 3.1%, which is an estimated increase of $780 million in payments from fiscal year 2023. This results from the 3.3% inpatient hospital market basket percentage increase reduced by a 0.2 percentage point productivity adjustment. Beginning in fiscal year 2024 and for each subsequent year, hospices that fail to meet quality reporting requirements receive a 4 percentage point reduction to the annual hospice payment update percentage increase for the year. The fiscal year 2024 rates for hospices that do not submit the required quality data would be updated by minus 0.9%, which is the fiscal year 2024 hospice payment update percentage of 3.1% minus 4 percentage points. The hospice payment update includes a statutory aggregate cap limiting the overall payments per patient made to a hospice annually. The hospice cap amount for fiscal year 2024 is $33,494.01, which is equal to the fiscal year 2023 cap amount $32,486.92, updated by the fiscal year 2024 hospice payment update percentage of 3.1%. Hospice Quality Reporting Program. CMS codified the Hospice Quality Reporting Program Data Completion Threshold Policy at Part 418, Section 312, and provided several updates relative to the development of a patient assessment instrument titled HOPE and future quality measures. CMS also provided updates on health equity related to Hospice Quality Reporting Program and future efforts to develop health equity measures. CMS updated the CAHPS Hospice Survey and discussed the results of a survey mode experiment conducted in 2021. Hospice certifying physician enrollment. Under CMS's existing regulations, 1. The hospice medical director or the physician member of the hospice interdisciplinary group, hereafter the hospice physician, and 2. The attending physician, if the beneficiary has one, must initially certify the patient's terminal condition. For subsequent periods, only the hospice physician must do so. As part of CMS's larger strategy to address hospice program integrity and quality of care and under their authority under Section 6405 of the Affordable Care Act, CMS is finalizing their proposal that these two categories of physicians must be enrolled in or opted out of Medicare for hospice services to be paid. Requiring enrollment or opt-out will allow CMS to screen the physician to ensure they are qualified, example licensed, to certify the terminal condition. In response to concerns raised by commenters, CMS will not implement or enforce this requirement until May 1, 2024 to give unenrolled and non-opted-out physicians more time to enroll in or opt out of the Medicare program. This is it for today. Hope you found this information useful. If you enjoyed this video, please consider subscribing to my channel. Thank you for watching. Bye now.